and welcome back to Bridging the Gap, Chronic Illness, Mental Health, and the Human Experience. I'm your host, Carina Schroedel. I am a licensed clinical social worker and doctoral student. This is the podcast that is going to explore intersection of physical health, mental health, and the lived experiences of families navigating chronic illness. So through research, storytelling, and conversations with professionals and individuals with lived experience, we're going to seek to better understand the human side of healthcare. And today, I am honored to welcome a fellow social worker whose experience brings a unique perspective to our discussion. Our guest is a licensed clinical social worker who previously served as a pediatric transplant social worker at Norton's Hospital, correct?
That's right. Correct.
Yes, and in that role, she worked closely with children and families facing heart failure, kidney failure, and bone marrow transplantation for cancer treatment.
Right.
So her work placed alongside families navigating some of the most challenging moments of their lives, helping them manage not only medical concerns, but also the emotional, social, and psychological impact of chronic illness. So thank you so much for joining us today.
Yeah, I'm happy to be here.
So before we begin discussing chronic illness and mental health, I'd just love for our listeners to get to know you a little better. So I'll just start by asking, what led you to this area of social work?
Yeah, I will say I didn't know much about medical social work when I went through my MSW. I kind of fell into it through an internship in the NICU at Norton Children's Hospital, and that really opened up a whole world of opportunities and learning about all the different roles that social workers play in a hospital setting.
And what was it about medical social work specifically that kind of resonated with you?
Yeah, I think you really meet people at their most vulnerable in a hospital, especially if, I mean, it's their children. So I think parents are even more vulnerable, and more anxious, more worried. And it's a great opportunity to step into a space where you are so needed. People are living out their worst fears most of the time with their children when they've got a new diagnosis. They don't know what the future holds. And so I love that I was able to just be a quiet in the storm, bring education, bring support, just bring a presence of being able to sit in a room with a family and just hear what they're going through. And then also, bring resources to them and see how I could ease a bit of their journey.
Absolutely, yes. So could you tell us just a little bit about the populations you do serve or that you were serving?
Yeah. I was the pediatric transplant social worker for Norton Children's for about 3 years. I ended that role in December of last year. I was assigned to heart failure leading into heart transplant, then also dialysis kids with kidney failure, end-stage renal disease, leading into being listed for kidney transplant when it was suitable, and then also some oncology patients that needed a bone marrow transplant.
Wow. As a substance abuse counselor myself, I can't even imagine walking in your shoes. So, what would a typical day for a medical social worker look like?
Well, always interesting, keeps you on your toes. You never know what's coming down the pipeline. But a normal day, the days that we like without any drama, would be visiting inpatient families while they're receiving care in the hospital. That would be doing rounds, seeing what needs they have, providing short-term counseling, resources, and just keeping up with the family, getting to know them and what they need. And then in the afternoons, there would be clinic, either kidney clinic or heart failure clinic or heart transplant clinic, where we see the families that have either already received a transplant or they are waiting for a transplant. Actually a big part of our role is preparing families and assessing them, doing a psychosocial assessment for transplant, a transplant workup to see whether the child and the family is really suitable to receive the gift, of organ donation.
So I think when many people hear the term medical social worker, it may not they may not fully understand the scope of the work. So what you're describing just really highlights how much support patients and families really need beyond medical treatment alone.
Yes, yes.
What would you say some of the most common challenges are faced by individuals living with chronic illness, just from your experience?
Well, yeah, I think, gosh, on the outside, everything changes. And I think a lot of the times on the inside, things change. I mean, obviously, there's the bills that start to stack up. So there's financial challenges. There's more transport to hospitals and to appointments. Your social engagement drops. There's not time to perhaps go to church, go to see family members, go to parties. Perhaps you're not allowed to be around other people so that you don't get more sick. I think that sometimes support systems crumble because they don't know how best to meet the needs, and people become uncomfortable, and so they don't engage and they don't support as much as what would be helpful. So certainly there's a lot of impact socially within the community, within families. But then I think on the inside too, I think chronic illness brings about a question of your own identity. Am I still the same person with this diagnosis? Am I now seen as the sick person? What does that mean? What can I do? What can I no longer do? What are my limitations? Am I still who I think I was? Now I feel like I'm weak, perhaps. Fear of the future. Certainly, mental health comes into the forefront because things are not the way they used to be. Your routine has completely changed. You may be dealing with pain all the time, which you didn't before your diagnosis. And, I think a lot of role reversal happens too. Perhaps if it's a dad in the family that has chronic illness and now suddenly he's not the big, strong guy that's perhaps bringing in the money. Now maybe employment has been disrupted. So certainly there's a complex amount of things that change and disrupt, a previously perhaps stable situation.
Yeah, that was something I actually was kind of trying to talk about a little bit yesterday in my podcast. Just bringing up the topic of the grief, and not grief like loss of a loved one, but grief as in loss of self, and that real spiritual aspect of it. It's like your whole meaning of life is going to be shattered with
Right.
developing a chronic illness or getting that diagnosis. So grief is something that we really have to address.
Yeah, I mean, they can have a spiritual crisis. Another thing that people don't often think about is that you lose your personal space when you have chronic illness. So nobody's interrupting you in your body. Nobody's sticking you with anything. Nobody's listening to you, your heart. Nobody's invading your personal space. And now you find yourself in a situation where doctors, nurses come into a room and they do basically what they like with you. And that can really be upsetting and not something people think about.
Yes, definitely. Now, whenever it comes to just talking a little bit about bridging that gap, what would you say some of the impacts are that healthcare providers might not recognize right away?
Um, I think, gosh, everybody's situation is unique. And so what we see in one hospital room might not be the same as what we see in another hospital room. And I think certainly we miss things, especially if there are families where there's a culture difference and they're not as maybe open as regular, individualistic cultures like Western culture, where people are more communicative. I think there can be a gap there with care, not hearing from the family. What are their needs? And so I think some of these things are missed. And, the medical team, they're just human. And
Right.
for many of us, we don't want to lose our empathy. However, it's a job, and you're seeing families in crisis every day. And I think there can be some compassion fatigue, which of course is not fair to the family that you're serving. But we have to, I think, check ourselves so that we can stay attuned to what are the things we might be missing with the family.
Yeah, and this is a big part of why I wanted to do this podcast is just to bring some awareness. I know doctors, they're there for the physical reasons. They're there to pay attention to that. I know growing up, so I have a chronic illness myself. I'm epileptic, and I had a lot of depression and anxiety and grief growing up, and I never once was I asked, like by a neurologist, do you need some sort of mental health care, or even asked about that. And I think it's just because maybe the physical doctors just don't know to go there.
Mm.
And I was too young to know what it was or how to bring it up.
Yeah, and I wonder if they feel, oh, they need to stay in their lane because they're not, medical doctors are not, unless they've gone into psychiatry, they have received very little training on mental health issues.
So just moving on, one of the themes that continues to emerge throughout this podcast is that chronic illness doesn't just affect the body, it affects every aspect of a person's life, including their emotional well-being. So, what emotional responses do you commonly see after someone receives like a chronic illness diagnosis?
Yeah, I mean, that's a good question because, of course, everybody, I think they all react in their own unique ways. But I think it's fair to say most people go through the 5 stages of grief. I think we often see, of course, the disbelief. Oh my gosh, I can't believe this. This is happening to me, or this is happening to my child. See a lot of parents get angry. Why my child? Why me? Why us? We're good people. Are we being punished for something? And then there can be bargaining. I mean, this can be in a spiritual context, like, please God, can you just fix this now? Please don't let this be us. Or even bargaining with the team, with the doctors. Like, are you sure? Can we rerun tests? Maybe that's not it. Or did we do something wrong? Can we do something better? Can we eat better? Can we, so we see the bargaining stages, but they also jump between the stages. They might bargain a little bit, go back to being angry, then they might just be depressed, and we see the change in them. And then they might cycle again and be just like, I can't believe this is happening. I just can't believe this is happening. So, yeah, that's generally what we see of those stages of grief.
And do you often see people struggle with things like anxiety, depression throughout that journey?
Absolutely. Yes, absolutely. I mean, as you can well imagine, because the rug has been ripped out from underneath them, and many people that have never had mental health struggles before, certainly this would perhaps be a first time for them to experience this, like, oh, the surge of anxiety, the surge of the unknown, that just doesn't go away because the problem, the challenge is still there every day.
And for the people you've seen like successfully live out life with a chronic illness, what would you say, what kind of coping skills do you think they have or have you seen?
Certainly, and we know this from research, the ones that fare best tend to have a healthy spiritual life in some way, shape, or form. They tend to do better. The ones that are in good community, have supportive families, or even just good community support in terms of friends that have been previously engaged socially, church support, or in some sort of sport club, where there are people around that can come to provide that support, they tend to do well. Interestingly enough, some of the patients and families that I've come across that have had mental health struggles before and have filled their toolkits with good coping mechanisms, then use them. They know to go for a walk, think about self-care, pace themselves, for caregivers to take breaks away from the hospital, and to use what they've learned before, perhaps in the moment if they're having an IV put in, to do some kind of grounding or imagery or breathing techniques. So those are the ones, yeah, that really fare well. The ones that struggle are the ones that just don't have much of a toolkit, and perhaps aren't as resilient as others. This is all new to them, don't have the support, and just are sort of, yeah, just shell shocked and don't know where to go from there.
Yes, absolutely. And I was doing some research also on that, like trauma resilience
Mm.
and trauma recovery. And I also did a little bit of hope research and learned a little bit about the hope theory. And yes, it's actually like evidence based. If you have a good support system, a spiritual foundation, and just motivation to like focus on today and moving forward rather than focusing less on the symptoms and focusing on the strengths you do have and what you can do with those,
Right.
which is very interesting. And I think that's definitely what we need to be talking to our patients about in that area,
Yes.
especially for those who are dealing with like loss of hope.
Yes.
Um, let's see. Based on your experience, what is the one thing you wish more healthcare professionals understood about the emotional experience of chronic illness?
Healthcare professionals, I would say, or do you mean therapists? Can you clarify?
Um, just like more like the doctors and nurses.
Doctors and nurses. I would say that I would hope that they would advocate for professionals to be present when they're giving a diagnosis. Afterwards, that there's follow-up phone calls, follow-up visits. Not a lot of hospitals dedicate funds to paying for mental health support, whether it's a social worker or a dedicated, say, for example, transplant psychologist. They often don't dedicate funding to that, and so it just isn't present, and the medical teams are just left, holding the pieces. So I would say, yeah, if doctors and nurses and medical staff could advocate for that, it'll make their jobs a lot easier, and of course, a much better experience for our patients.
Yeah, thank you for sharing that. And I really like what you said about like having somebody present when giving the diagnosis, like maybe a therapist or
Yes,
something. Yeah, that would be, I think that would make a huge difference in the outcomes.
yes.
And just as we finish up, is there any message or anything you would like to share with individuals or families who might be navigating chronic illness right now?
Yes, I want you to know that there is a lot of support out there. There are therapists that are trained in managing chronic illness. And I think when you try to go it alone, you will grow some resilience, but the journey could be so much easier with the help of a professional. For example, when I serve this population as a therapist, I tend to use a modality called acceptance and commitment therapy. And I've had such success with that because it gives a nice framework for patients to use to learn to notice what's going on with them, not to be drawn into the pain, not or into the traumatic experience, to basically start to take control over it and not feel like they're being controlled by their diagnosis or their pain or their experience at the time. So I would encourage them to look for a therapist that is well trained in trauma therapy and working with chronic illness so that this journey doesn't have to be done alone and it doesn't have to be so hard. There are things that can make this a little bit easier. And, as they say, two heads are better than one. And so I would encourage them to do that.
Yes, and so thank you so much for sharing your knowledge, for sharing your experience and insight with us today. I think this conversation really highlights the importance of treating the whole person, not just the diagnosis.
Absolutely.
And it reminds us that healing involves physical, emotional, and social support. So, to our listeners, thank you for joining us for another episode of Bridging the Gap. If today's conversation resonated with you, please share it with someone who might benefit from hearing it. And until next time, take care of yourselves and remember that every health journey deserves compassion, understanding, and hope.